In this section, we're going to talk about applying the ACSM guidelines for exercise. A lot of us have that little teeny book sitting in our space, maybe our office or our gym or our clinic. We probably got it in school or we read about it somewhere, and we just maybe really didn't even touch on it after we got through our certification or our licensure. Well, we're going to kind of bring that conversation back to the forefront because it really is a nice way to not only talk with your patients and clients, but can help you in formatting your programming to make it more efficient and effective for your patients and your clients. So let's just talk about the FIT application. What exactly does that mean, and how do we deal with this for our patients and our clients? Well, we're going to talk about frequency. So how often? Example, a lot of us might say we recommend that you exercise 3 days out of the week, and we want you to take a day off in between every other day that you will exercise. Well, we want to consider, what does the ACSM actually recommend we do, and does our frequency match the frequency that is being suggested and is backed by a lot of evidence in relationship to how we're prescribing exercise. And let's just say that I have a patient or a client that only comes in to see me twice a week, and I focus mostly on strength and conditioning. Well, I need to make sure that I'm having the conversation that they're actually getting all the components of what is recommended, and have that discussion with them and help them map out, how do I incorporate aerobic exercise? How do I make sure that some of my exercises address balance and agility, which might be more indicative of neuromotor? And am I really doing the flexibility training that I need? Let's talk about intensity just a little bit. So intensity is, how hard are we going? This is going to vary depending on where our patients start at or our clients start. So is our client coming in the door, are they a beginner? Have they never really exercised a day in their life? Or maybe they exercised, but it's been 5 years. So now do we put them back into that beginner category? We're also going to think about our, on the opposite end of the spectrum, if we have someone coming in and they're used to working out hard, how do we maybe have to talk about with them what scale they need to be working out on to see the gains that we're desiring, and maybe to have respect with pain or discomfort that they're having. Time would be how long. We can talk about this in short increments, so I can say time, I want you to do 3 times 30 seconds, or I can talk about the whole length of my programming to say, okay, is this a 30-minute program? Is this a 60-minute program? If it's a 30-minute program, we know we're going to up the intensity because we're not working out as long or as hard. And then type. This can be varied, right? We kind of typically go towards our aerobic. We think about type as running, biking, and swimming. But we can also think about type in relationship to, is it a neuromotor exercise? Am I working on yoga? Am I working on Tai Chi? Am I really thinking about the strength part of my exercise component, in which I'm talking about more of planks and squats and lunges, and how does that relate to my patient's wants and needs, and then also what I desire for them to help them live a very healthy lifestyle. So let's get right to it. What are the average recommendations? So we're talking about people from 18 to 65. What does the ACSM put out there as what someone should be exercising? We're going to talk about aerobic conditioning first. We are noticing a trend in our culture that we sit so much more. So as we keep going along in conversation, this aerobic component continues to increase, and so does the time. We know that a recent study in the last couple of years showed that sitting is now becoming the new smoking, meaning that if we just do 30 minutes of daily exercise, it's not enough to undo the damage of what sitting does in a 10 to 12 hour period. So when we are talking with our patient or our client, we're going to talk about aerobic exercise, them working at a moderate intensity, so meaning on a scale from 0 to 10, that they're working out between the 6 and the 8. on that perceived exertion scale. So we can say we want you to be able to talk with us comfortably, but it's a little bit labored as you're getting more into that higher end of moderation, and that you should be doing that 5 days a week for 30 minutes. So let's think now, pause for a second and think about who is actually doing that in their daily life. Do we have a lot of our patients and clients that are adhering to this? I would have to say that no. I have to do a lot of education and a lot of motivation to help my patients and clients really understand that this is very imperative for them to be healthy, and so they will prevent having back pain and knee pain, because our body needs that movement and that fluidity to really stay healthy. We can say that if they can't get in 5 days a week, okay, then you need to up the ante. You've really got to be doing 20 minutes, but it's got to be a high intensity. That means that for 20 minutes solid, that you are working at least an 8 or above on that perceived exertion scale, so 8 out of 10. We're getting up into the higher ranges of a heart rate, which we're not going to dive into very much. That can be something you can self-study on your own, but thinking about their heart rate and what is that doing for them and how are they able to do that. When we jump down into the strength training component, we're talking about they need to do 8 to 10 exercises. So we're talking about the major muscle groups. So we should all kind of know those off the top of our head, but we're talking about the quadriceps, the hamstrings, the glutes, the calves, our biceps, our triceps, our abdominals, our paraspinals along our back. We're going to think about our deltoids. So thinking about those, we're trying to hit all of our major muscle groups and trying to get at least 8 to 12 repetitions. This is going to be indicative of hypertrophy, which we're really trying to see strength gains. This has to come 2 to 3 days a week. I work with a lot of patients and clients that tell me, yeah, I strength train, but they're only getting in 1 day a week, and it's just not enough to keep the gains that they get. And they feel good after that 1 day, but they're just not maintaining that strength and that ability to hold that strength. Let's talk about flexibility. So this is just kind of one of those general, you need to do 60 seconds to the point of tightness and discomfort. That really doesn't tell us a lot. What I'm going to suggest to you and really challenge you to do is think about, what does our culture really put us into? Well, we all have kind of that anterior chain tightness. What does that mean? Well, our hip flexors are tight, our quadriceps are tight, our abs, even though that they're weak, they kind of get bound down, especially as we come into the pelvis. And then we look up above, and our chest, we have rounded shoulders, so we're looking at our chest, especially that pec minor coming into it, and we're starting to get that forward head posture. So thinking about alignment, we really want to think about flexibility that attacks our whole kinetic chain. How can we do maybe more flexibility that helps us out in the long run, is not so isolated? We're all very busy. We don't have a lot of time, and so to get all of this in, we need to start combining things. So can I do a kneeling hip flexor stretch in the doorway, where now I put my arms up above me, now I'm getting that lat stretch and that pec stretch as I go forward. So I'm really affecting that whole front of the body. When I think about the posterior chain, a lot of us will come back and say, oh, my patient or client has tight hamstrings. Well, one of my favorite ways to really assess their posterior chain mobility is to put them in the downward dog position. Let's see, can they put their heels on the ground? Is it their calves are tight, their hamstrings are tight, and where that low back, where all that thoracolumbar fascia comes into play and the lumbar paraspinals come into play, does that all tension up? What you'll notice with your patients as you get them into this downward dog position is a lot of them are having some of that neural tensioning. This is, if it's severe and it's causing symptoms, then make sure that you are taking care of them if that is within your scope of practice. If it's not, get them referred out. Get some good manual therapy work done to really release some of that tension in that area. But we do want to get into that and out of that. So maybe even prescribing 10 minutes of yoga for your patients a day to really affect the flexibility would help greatly. Neuromotor is one of the ones that is the most confusing for people, but not when we really read the description. We're talking about balance, agility, coordination, and gait. Well, so does that mean I have to do 20 to 30 minutes independently of all the other things that I did? No. What they are trying to tell you is that when you're doing your strength and your flexibility and your aerobic, make sure that you are incorporating some type of neuromotor exercises at least 2 days a week, hopefully 3 days a week into that programming. So what might that look like? Okay, well, let's take strength training. Let's say I can do just a static bicep curl. Or if I want to add in some neuromotor component to that, I can do a single leg stance with my opposite knee held nice and high, now doing a bicep curl. Because I'm now getting a neuromotor component to it, I'm working on my balance, but I'm also getting my strength component as well. I might also incorporate some type of agility and coordination into my warm-up. That would be a great area if I'm doing something like that during my major programming, that I've now incorporated some agility. So even just some grapevines, some lateral shuffles. Think about with agility, change in direction. It doesn't always have to be plyometrics, but thinking about that throughout the span of our population. So we think about the 12-year-old that has just had a growth spurt that can't quite figure out their body, all the way to our 65-year-old that as they age, maybe they're losing some of that ability to turn and twist, and we really want them to be able to do that.